Hey, Pepin.
Yo, yo.
Did you hear the news story lately about the euthanasia?
Oh, wow, that's kind of dark.
You mean like the color of their skin, or?
No, just the topic in general.
I don't know if we understand each other. I think we need to talk. Welcome back. So glad you could join us. My name's Meader. I'm sitting here with a couple of people who I enjoy spending time with. One of them is named Nathan.
And otherwise known as Pepin.
Oh, Pepin. And, of course, we have Brieann here, who otherwise known as B.
Thank you.
Absolutely. And today, I think we're going to talk about euthanasia. I don't know if, Pepin, you understand what topic I was getting at.
So this is like where doctors will they will release people from their suffering.
No, what?
You know, if they're in immense pain, let's say someone is like undergoing lots and lots of chemotherapy, and they could keep going, but it's going to be like another 10 years of hell.
I was talking about like how in China you can't have too many kids, like the youth in Asia. I like your topic better. Let's talk about murder.
Okay. Oh, murder, though?
Okay, so euthanasia. Somebody give us the definition.
I would say it is kind of assisted suicide facilitated by a doctor, and it's under conditions of the person who's being killed is in some kind of pain or jeopardy.
I have to concur. It's the release of human life based on their current health deterioration.
So the doctor is murdering somebody.
Doctor death.
By legal definition, the doctor is murdering somebody.
I would not say it's murder.
By legal definition.
Let's not talk about legalities, because there's different laws, different places.
We need to talk about the legalities.
Well, because legality, legally, it's defined as murder. Let's say, yes, okay. But you could say, should it be murder? And that's another topic. And also,
absolutely,
it's more of a thing that's defined as, murder. It's not necessarily murder in itself.
Okay. But introducing the topic, I think it's vital that we bring up that this is a heavily debated thing. A lot of people feel really passionately about it, be it for themselves, be it as a doctor, be it as a family member of somebody who does want to partake in euthanasia, etc., etc. But there is a legal aspect to it as well, where if you take it strictly by the letter of the law, the doctor is committing murder. That's not what we're focusing on today, but it is an aspect that exists. And that's the only thing that I wanted to bring up about the legality of it.
Right. Though I would object to it being... So if you have the definition of murder, which is to kill someone against their will, then by that definition, let's say that's just the legal definition of murder, then it doesn't meet that criteria. But what they do is they say there's a criteria of euthanasia, which they put under the place of murder. So they classify it as an act of murder when it's not against the person's will. So that's the only aspect I would kind of argue against, because to the letter of the law, it's not technically murder. But as far as the law is applied and as far as they kind of put it together, it is murder.
I was unaware that the law takes into account the person being killed's will. I'm pretty sure murder is taking somebody's life regardless of will.
No. So the distinction there would be... So there's like killing someone. Killing someone is not necessarily against their will. It's kind of there's no preference involved. Whereas murder, there is preference involved. So the person who is being killed does not want to die, while the person who is killing wants to kill them. There's also homicide, whereas the person who dies doesn't want to die, obviously. But the person who does the killing doesn't necessarily want to kill them. It's more of an accident.
Manslaughter.
Yeah, manslaughter. And also manslaughter is the correct term there. There's also, like, say, the difference between rape and lovemaking is the fact that, with rape,
Consent.
one person wants to have sex, the other person doesn't. With, consensual sex, both people say, yeah, sure.
So when we're talking about, I think what we really want to delve into is the ethical dilemma around this, not the legal dilemma. But to wrap up the legal dilemma, is it legal to perform euthanasia currently in the United States?
Not on people.
Okay. That's an awesome distinction in itself. Do you want to go into that at all?
Well, I mean,
because that might lead us into the ethics.
Absolutely. Well, Pepin's talking when he was going through the definitions, and I came up with manslaughter, which is the correct terminology. The at-will thing really stuck out because that's an argument that people who are against euthanasia goes and they attack ethically that, no, this isn't right. We need to have compassion. Well, why is it okay we can do it for animals when they really themselves can't always give consent? And that's compassion, yet when we're doing it for another human being, it's murder.
Because there's a level of empathy and compassion necessary to when you have complete higher mental capacity over somebody or over something else that's alive, such as an animal. An animal doesn't have the ability to communicate that, and an animal is of a lower level of intelligence. And like a human has the distinction to be able to make that, or the ability to make that distinction of
because
how much
humans
pain
can reason things out more than animals.
Mm-hmm.
I don't agree with that because you can go on a medical portion of that and look at the signs in an animal. You can look at the blood work. You can look at them just by watching the way they act, because animals run so high on instinct that their actions are kind of blown up more than maybe what a human would do for their kind of range of emotions. If they're not feeling well, I'm not feeling well. Well, that could be mentally, that could be physically, that could be just about anything. But animals, really, it's on a higher level. They actually tell us more without telling us, and you can run all the tests to prove it.
Mm-hmm. So what is the argument here exactly in that respect? So is it more ethical? Like, it sounds like you're in favor of euthanasia. Is that correct?
I am absolutely in favor of it, yes.
So is your argument right there that the fact that animals show these signs so much more than humans, that it's more ethical? Or it's the fact that they have these very outlying symptoms of, needing to be released, needing to be let go, that it's even more justified in doing it?
Yeah, against the argument when people are so against human euthanasia, but they're like, we got to be compassionate to animals, because that's usually in the people that I have dealt with, that's usually their strongest standpoint is animals. Look at the animals. We have to be compassionate. Well, we have to be compassionate to humans too, and that's what they argue. So how come it's okay to euthanize an animal but not a human? Show that same compassion, because they actually hold, in a lot of their arguments, animals higher than humans.
So your argument is kind of the other way around in a way, or maybe they're equals?
Equal. I see them as equal. Animals and humans are equal.
See, the thing I don't get about this, I'm not very aware of these arguments, but the thing I wouldn't get about this argument with compassion being having more compassion with animals than with humans, is that humans are actually capable of voicing their needs and concerns and their wants. Euthanasia on an animal is one thing because they actually can't say what it is. That seems kind of controversial to me. It should be more controversial because they can't say, no, I don't want to die, or they can't say, don't fucking do this to me.
Right.
But the human is, provided that they're in a rational state of mind,
Psychosis.
They can actually make this decision, and you can actually know for certain, yeah, they want to die. They're in so much pain.
Yep.
Humans are much more complex, so the situation immediately becomes more complex because there's mental aspects, much deeper mental aspects, and the human body is much more complex, and the advances in science for humans compared to for animals is so much more vast that, if they have another 3 years, there may be a breakthrough that saves their life if they don't give up now. Versus animals, where there's not going to be much changing. You're going to see a change in a human, something that would save a human's life well before you'll see that same advancement for animals. And then the animals don't have that. They can't actively say, like, I want to die. I want to kill myself, or I want you to kill me. So everything that you're reading off of them is just straight honest and true to what they're actually feeling. And if their brain is fucked up to the point where they're giving off symptoms that they need to die, then that's probably the humane thing to do in the first place. And that's why I think the argument is made that it's more humane to take an animal's life than it is to take a human's life, because there's less complexity around it. There's less chance that that this is going to be misconstrued in some way, exactly like you were saying, Brieann, because whatever they're showing is what they're feeling.
So something about animals is that, as far as complexity goes, is they don't have as much to do as we do. So I've heard about stories, it's not every story, but the stories about people who have debilitating diseases or debilitating complexes, or they lose their eyesight, or even Helen Keller, she was blind and deaf, and they still live out meaningful lives. So even with these huge kind of hurdles, they can do that. But you have other animals. Let's take a horse, for instance. If they break their leg, they can't live any meaningful life. They will have a suffering existence. And it's not like humans, where they can kind of do other things. They can go with other aspects. They're just kind of stuck in this kind of thing they're not actually made for. And it's not like we're made for, kind of having these kind of unusual circumstances, if we're blind, living a blind life. But we can kind of cope with it better because we are more able to cope with it due to our minds.
Right. So Brieann's clearly passionately for euthanasia. And Nate, you seem kind of like at the in-between, where you're not really well versed on either, but you could make a rational judgment one way or the other based off of circumstances.
Right. So the main factor for me is the person's state of mind. So if the person's state of mind is not sane, or they're in a state of psychosis, it doesn't seem legitimate to perform any sort of euthanasia or whatever medical procedure. So let's imagine someone is drunk, right? Mm-hmm. And they say, kill me now. Well, the prefrontal cortex isn't actually functioning with that person. It would be completely wrong to kill that person, just as it would be completely wrong to have sex with that person if you are not drunk yourself. So, as far as that goes, you got to make sure this person's in a good state of mind. And you could make the argument maybe that a person who is suffering this badly might make the decision poorly, or making a rational decision to kill me now because I'm just suffering so much, when, from the doctor's point of view, okay, this will just be another month or two and we'll have you fixed up in a jiffy. Right? So you have to take that into consideration, because they might be in a lot of pain, but, is this a rational point of view? There's another just little thing right after that. Let's imagine that someone is walking across the street, right? And they're about to get hit by the car. Well, it is completely justified to push them out of the way, mm-hmm. right? Now, pushing someone like that would normally be an act of violence, right? They could actually prosecute you, maybe sue you for that,
right, and
want a lot of money. But in this instance, it's completely okay, because this person, in a rational state of mind, after the fact, would say, yeah, I'm glad you did that for me. So I think that's kind of my stance on it. So,
Meader's right. I'm passionately pro euthanasia, and I think one of the arguments that I come up against a lot from people who are against it is the state of mind, psychosis. That's not fair. Maybe they can't make that judgment call, and maybe their quality of life isn't that bad. And a lot of people act hotly to people who are pro anything, abortion, they react really hotly to that, because that is a huge topic and a huge concern. But what a lot of people won't take the time to do, in my experience, is hear me out, where I am on agreement with you. If someone is not mentally there, there's no reason for you to say, yep, I agree as the doctor. Absolutely, that is that is killing. That is murder, because that person's not okay mentally. Maybe they're okay physically, and like you said, they're in pain, but they're not there. So that's where you bring in a psychologist to assist. You bring in family members, people close, to help discern that that's not a correct action. That's not a normal behavior in everyday life. They may not know medically, but they know when someone acts a certain way or something's kind of off. So to kind of help collect that data and then make the educational decision based on the data. That
thought is almost scarier to me, that if I was the person in the situation of requesting euthanasia and a family member was to decide whether I was in my right mind or not, let's say it's a vindictive family member that doesn't like me, or it's one that's heavily grieving and can't let go of me and would just state, no, they're acting crazy just to prevent it from happening for their own selfish reasons.
Wow, that is the story of my grandmother, actually. My grandmother, when I was 7, passed in the hospital. She slid into a coma, and her youngest son had all the rights, and he had just lost his wife 2 months before that. He was in no mental state to make a decision, and he wanted her gone because she was in the coma for like 12 days. Doctors were kind of on the fence. They were like, but they were more like, give it a little bit, give it a little bit. And he said no. And a lot of the family members had to bring in and say, hey, he's not okay, doctors, don't let him make this decision. And there was a daughter there, and she too was close to the mother and wanted, hey, no, she needs to go. She's not with us anymore. And then my dad was brought in, who was not close to my grandmother. In fact, they didn't get along. They did not like each other. And they said, okay, Brieann, what's your opinion? And my mother, who was divorced from my father and close to my grandmother, said, please, Brieann, just a couple more days. And my dad said, I agree. Neither one of my siblings are okay to make this decision. She needs to, let's wait to see. She's been showing a little bit of progress. Give it a couple more days. Let's see what we can do. She woke up 2 days later. So I see where you're going with that, and that's why you need more than one family member. It has to be a group effort. It really does, from multiple sides.
But even then, if you're going by the family member, and this is a very, okay, so I want to start by saying that there are an infinite amount of circumstances
right.
and possibilities that would all warrant different outcomes.
Right.
There's an infinite amount of possibilities that would say, yes, euthanasia should happen in that situation, and an infinite amount that don't. So what we'll do is we'll just tease out. We'll probably just go over a few scenarios and talk about those specific scenarios and the philosophical quandaries and ethical quandaries found within them. So in this one, my issue with bringing family members in to make decisions in the case of the person being incapacitated and unable to make the decision themselves, and there's kind of that in between of should they, shouldn't they pull the plug, that type of deal, is if there's family members who don't care about that person. I think the assumption that is being made when you say family members should be brought in is that family members give a shit, and that's not always the case. More times than not it is, but sometimes it's not. Let's say this was somebody rich that nobody gave a fuck about within the family, and they just all wanted him dead so they could get their inheritance. Like, then that's an awful situation to bring them in, because even if she is showing signs of progress, they're not going to care, because all they care about is themselves and the money, or getting rid of that person.
To step back for a second, so in this instance, we're talking about someone in a coma, right? Mm-hmm. So let's imagine someone is not in a coma. In that kind of case, I don't think the input from the family members would be as needed. So, like, family input is great if someone can't make a decision themselves. But if they can make the decision, then you might just need the family members to verify that this person is in a sane state of mind, that they're acting normally.
Yeah, that's what I was going towards. Not.
So this reminds me of a thing with insurance claims. So insurance companies will have these kind of big long fill-out surveys, where lots of bubbles and asking questions and stuff, and it's a very long survey, and it's just make sure there's no fraud involved, and they're very simple questions. Now, what ends up happening is that people who are trying to lie about it will usually end up failing the quiz. Or people who are a little too perfect on it, they end up failing. And they have this kind of weird rubric where they can figure out who's telling the truth and who's lying based off this kind of psychoanalytical models. So I think that if you were to apply this test to someone who is, suffering and wants to be released, or even to the family members who maybe perhaps have malign intentions, I think you could catch out a lot of them, and this would kind of solve part of the issue. I think there's ways to screen people. Nothing's going to be perfect ever, but...
Well, that's why the team of psychologists, psychologists, not psychiatrists, should be involved, because they are trained to weed that out and look for that, and they're like that test. Really, they help get those answers out.
Yeah, and we could assume that if there was a natural psychologist looking at, the family, they could see the family aspects and the family dynamics and to be well versed in this. And they could say, okay, this family member is not in a state of mind to make that decision for them, if they're in a coma.
I want to kind of edit myself a little bit. When I said family members should be brought in, it should not be the deciding factor by any means, but it should be used as a tool to help the psychologist and the doctor involved in the case. And again, like you said, it's a case-by-case basis. It's all, we could sit here and do this all day, but it should be a tool for them to help them come to that educated decision.
In the instance of somebody going into a coma and there being no preparations made beforehand by the person in the coma, if I go into a coma, I want this person to make decisions for me. I agree. I think that the family members can be brought in and talk to psychiatrists and the doctor, and they can all kind of talk and make decisions. And then the final decision needs to come down to the psychiatrist and or doctor,
right,
because they're the healthcare professional and they don't have an emotional investment more than, any human with empathy. Right. But I think if there's somebody, if they have like a living will type deal where they're like, if I go into a coma, I'm incapacitated, I want this person to make decisions for me, they should be able to override the doctor in those situations, because you're assuming that when they're making this will of sound mind and body, that they're trusting them to make the same decision that they would want made for themselves.
Right. I think that's definitely a good point. And it's kind of interesting because if you're doing something with a lawyer, the lawyer has to word things in a very careful, legally worded way. And it's very, very impossible to misconstrue the intent.
Right.
Unless you're a politician.
We all seem to be pretty much on the same page on that. So I'm going to springboard us in another direction now and say, so sometimes the decision is made when someone's in a coma to not pull the plug. And, you made the argument earlier of a situation where in your own personal life where somebody came out of the coma despite the fact that other people would have pulled the plug and they wouldn't be alive any longer. So like they were given a second chance basically. Mm-hmm. And it seems like you can draw the conclusion that that was the right decision to wait in that situation.
Well, when she came back, she didn't have a lot. She couldn't speak. She lost that functionality. So she had to write everything, and she even lost some of that functionality. So she kind of had to relearn it. And she was only back for a couple days. She did thank my dad and said, at least I have the opportunity to say goodbye. But I want to go. So did he really make the right decision? She didn't say, but I don't think...
Based off of what you just said, she did say.
Well, yeah. She wanted to go, yeah.
She thanked him, and then she made the decision.
She was glad that she got the opportunity to say goodbye, but she wanted to go. It was... So, I mean, there was some good with it, and... there was some bad.
Now, I had a situation in my life where somebody close to me fell into a coma, and they didn't think he was ever going to come out. and then one day he just did. But at this point, he had severe brain damage and had to be in an institution and was living a pretty awful life at that point without, how did you phrase it earlier?
Quality of life was poor?
Yeah, with a poor quality of life. And, was that the right decision in that case? If they come back and they have a poor quality of life and then they end up suffering more because you chose to keep them alive, I just want to bring the duality to, in some situations it's the right choice, and in the same exact situation it could be the wrong choice.
This is where it's really tough because it's the hindsight bias. So we can look at all the cases where someone is left to be in a coma or in a terrible state like that, and then they wake up and they're so happy and so glad, and I'm so glad you didn't actually kill me off there. And then we see all those cases, but we don't see the other cases where the person would have wanted to die, or the cases where they are there for 40, 50, 60 years and they don't wake up. I don't think that's for that long, but so there's that bias there, and it's still very hard to dissect, even being aware of that bias.
I don't know. And again, from my personal experience, we did hear her say, yes, you should have let me go. I wanted to go. I needed to go. Because what she explained to the adults, who later explained to me, because I was too young, was she could hear everything. She was stuck. She wasn't here and she wasn't there. And she was there, but she wasn't there. And she was just trapped, and the release had to come. It had to come for her. And she said, I want to go. Should have gone. Pull the plug. But what about the people who don't wake up?
Yeah, and that's what Nate was bringing up.
Yeah.
With the 40, 50, 60 years. And
that's where I'm like, there's my argument for pro-euthanasia, because they're stuck, according to my grandmother. But even if I don't look at that aspect, maybe I never had this experience. I'm coming out with this pro-choice of doing this. What quality of life do they have? They're hooked up to a breathing machine, most of them. They're hooked up to a feeding tube. There's no real brain activity. What quality of life are they really having?
I think the argument would be that in many cases they don't actually hear anything. So in many cases there's nothing. Maybe every once in a while they have some kind of consciousness, but it's just nothing. So it's just kind of like sleeping. You go to sleep and you wake up, and then you're alive, and then you have your quality of life. So the whole in between isn't there. Now some people, obviously it is, but if personally myself, let's say I got put into a coma for say 3 years, right? If it's just like sleeping, I wouldn't mind that. It's just like I wake up 3 years later, it's like, okay, that was weird. But if it'd be totally different if I was awake for all those 3 years. That would be really boring.
But sleeping, the brain has activity, lots and lots of activity. There is no activity.
Well, yeah, I don't mean like sleeping, like literal sleeping. I mean like just like like. Have you ever had like a really deep sleep and you like close your eyes and you wake up?
I've been put under 3 different times, and I do equate it to the loss of time.
Yeah.
And they say, it's just like you're sleeping. So yes, okay.
Yeah, not literal sleeping, just kind of
like that. It's just that loss of time, but you wake up and you're fine.
If you've ever had anesthetics, oh god, that's fucking weird. It's just like
you either wake up laughing or you wake up crying.
Count to 3. 1, or actually count backwards from 10, 9, and then you just kind of like, I'm in another room. What?
Yeah, because you lose that time or whatever. But you're fine when you wake up, and you either laugh or you cry.
I was just confused.
Really?
It's like, oh, I'm here. That's weird.
Oh.
It seems like with comas, there's so much that isn't understood. There's so much uncertainty, and there's so many factors in different situations that could be involved that we could probably talk about a million different circumstances involved with just comas alone. But I want to know about you guys' thoughts in regards to euthanasia when the person is alive and the person's in so much pain that they ask to be killed. How do you feel about that situation?
Well, like we were talking about earlier with, having the whole warrior thing and having the guy reason out with a warrior about death and stuff like that. I think if you can determine someone's at a healthy mindset and you can get it kind of legally kind of defined, or make sure it's within legal bounds. So let's say that the person is making a rational decision and that this is covered under the law. That even if a person is completely happy and has no reason to kill themselves and not suffering or anything, it's their body, it's their life. They can choose to do what they want to with it. I think it's it's. Why stop them? That's kind of like controlling their body against their will. Now, like I said, if they have psychosis or some other thing like that and aren't capable of making that rational decision, well, no, they shouldn't be doing that. It's just like pushing someone out of the road if they're drunk, or restraining someone if they're about to jump off a building when they're undergoing some crazy mushroom trip.
Someone who is happy and of complete sound mind and body is not going to ask to have themselves killed.
There has to be a driving reason for them to ask that, like pain. Okay. Pain. Yep. Or you have to look at, okay, so does this person have cancer? Do they have a medical illness that only deteriorates them with time? Is there cures? What are those methods of cures? Chemotherapy, radiation, that actually most people die from those treatments before they can even die from the cancer itself. But not all. Obviously, there are success stories. But you have to look at, what do they have? What are the probability and the chances of a quality life? And we got to get to the definition of what is quality life. But you have to look, okay, is this person going to be able to live? Or are they just going to be sitting there and hoping to die because they're in pain, they can't move, they can't do anything?
So to be clear, you disagree with my position here. And it's fine if you do. We can have a discussion about it. But like what is, these are saying pain is differentiator between that, right? So these people are suffering, and there's these costs and benefits that you have to calculate out. Mm-hmm. But why can't someone who is in control of their body, is capable of making rational decisions, not capable of saying, I don't want to live anymore?
Because pain makes you incapable of making rational decisions. You do not make rational decisions when you're experiencing pain to the level that you want to kill yourself.
But we're not saying this person's in pain, though.
I am. I'm saying that nobody wants to kill themselves that's not in some sort of pain.
I don't know. I could imagine some old people who have had a nice life. They're like, oh, okay, I think I've had enough of this. I'm cool dying right now. That's fine.
Well, and that's why people are like, this is...
Then they can kill themselves. Why do they need to go through euthanasia?
Well,
no, I'm not saying euthanasia. I'm saying just in general, just killing.
A lot of old people, they're on heart medication. They're on some sort of, and that's a huge topic, is healthcare for old people. We have so much healthcare or so much medicine out there to help to longevity. People are living much longer, and do they really need to? No. I don't think they need to live to be 107, 109. I think once you reach 80s, 90s, even then, it is time. So in some cases, not all, why are we giving them medication to help them live longer? And is that really euthanasia?
Well, we're giving them medicine to live longer because they want to live longer, right?
Right.
So these people do. You're arguing that they probably shouldn't, but they do because they want to extend their lives. But let's say someone doesn't want to take the medicine, or someone doesn't want to live like that.
Well, and that's what I'm saying. And that's what I was saying in your argument, is they can just stop taking, if it's someone who doesn't want to live anymore and they're on medication to help them with whatever issue or ailment, they can just stop, and then they'll go by natural attrition at that point.
Why can't they just find a doctor to, inject them with some morphine, like a
Because
Dr. Kevorkian.
because that's forcing another person to take your life, and that's fucked up. If you want to die, you should handle it yourself. If you're at that level, you're that sound, mind, and body, nobody can stop you. Like, that's your prerogative at that point. But it shouldn't be a doctor's responsibility to release somebody from their body at that point.
I wouldn't say it's a responsibility. It's something they take up themselves. They would have to agree to it. So it's not something that's forced on them. These doctors would do it themselves and be willing to do it because they understand the motives behind it.
Enter Dr. Kevorkian, or Dr. Death. He never once injected his patients. He loaded the needle, put it down, walked out the door. And he still got his license pulled and still jailed for killing people. And I agree with his method and view on that end of, if they don't want to live anymore and the reasons all stand there that they shouldn't, and it checks out. Here it is. Let me walk out the door. Because it isn't the doctor's job to do it, per se.
Well, I don't know, because these kind of...
I think it would...
I think it, as a human being, if you have any sort of sympathy and or empathy, it takes something out of you to take somebody's life, even if it's completely justified. And to put that weight on somebody just because you're done with life is screwed up and selfish. And should you be given the opportunity to do it yourself? Maybe. There's great argument for that. But should there be somebody who takes on that responsibility? I don't think so. And
I actually agree with that. And that's why I say I think it was very compassionate for Dr. Kevorkian to do that, because he went in, he saw his patients, they did some talking. Yes, I want to die. Okay, what's going on? This is going on. Load it up. There it is. Walk out the door and go. Because there is a human aspect to doctors. They're a little one. It's there, but you don't want to kill that aspect because that's what grounds doctors for the most part.
So to be clear here, the difference is in the case where a doctor does this to a suffering person, they can understand on a empathetic, emotional level that the person is suffering and that by injecting these drugs that they are releasing this person of the suffering. Whereas in the case of someone who is not sick, when they do that on some kind of emotional level, their brain doesn't get that. That's the problem, that they don't understand on some kind of level that they aren't murdering someone.
There's a difference between stopping somebody from pain and just killing somebody because they want to die.
And I think I go further than pain. Pain is a huge reason. It's a symptom. Okay, so here's a huge symptom, pain. What else is there? Okay, and that's why I said then again, you got to look. If they were to live a year now, 2 years from now, 3 years from now, what is their quality of life going to be? Do they have a terminal issue that's slowly shutting down organs that are essential for life? And that has to be taken into consideration. That's when, euthanasia should be administered. And how it should be administered, like I said, I personally agree with Dr. Kevorkian. Just load it up and go.
See, I'm going to go even further on this. I'm going to double down here.
All right.
So let's say there are negative psychological impacts of, say, killing someone or committing assisted suicide, right? Doing that. Mm-hmm. So let's say there's terrible, terrible impacts on someone's health because it's essentially murdering someone, who is not suffering, who doesn't need it, let's say. Well, let's say we can establish that as a fact, absolute fact.
Okay.
I still think the person who is administrating the assisted suicide should be aware of that, of course. But if they see those risks and still want to take that action, they should. They should be fully able to take those risks. It's similar with smoking. If someone is smoking, as long as it only affects themselves, they're not smoking in an enclosed environment, they should be able to take that action and accept those risks of those consequences. In a similar way, someone who is going to commit or someone who is going to administer assisted suicide, if they're aware of the risks, if they're aware this could fuck them up, then I don't see why it would be a problem, because it's their body, their life.
Because the mental faculties of a doctor is pretty important. So if they're going to start doing something that deteriorates their mental health, maybe they shouldn't have their doctor's license anymore.
So this is hard to answer in general, because they do a lot of stuff that, might deteriorate that.
Yeah, and if a doctor's on meth, I don't want him working on me. If a doctor is hit on the head and has a concussion and is trying to do surgery, that's probably not a good thing. So if he's doing this action that is causing him his mental capacity to deteriorate based off of the circumstances that you just laid out, which are not proven in any sense, they're more emotional feelings that Brieann and I agree on that it sounds like you don't necessarily agree on, but for reasons of argument. And if a doctor's doing something that's deteriorating his mental capacity, then he should not be a doctor.
Well, I mean, to what degree as well? I mean, just in general, or to, you got to assume that doctors go through a lot of stuff that will, put them through a lot of stress, put them through some depression. And even then, would it even be a problem with surgeons? Because there's probably, not surgeons, would it even be a problem with these assisted suicide or... That's a term.
I love
now.
that.
That's
I
a
love
term.
that.
So let's say what this is causing is desensitization. So now they're not as broken up when people die. So now they care less about people's overall health, and that doesn't make a good doctor.
Well, I'm not even saying it's a problem of I'm not even saying it's a factor of desensitization, but rather it's more of a selection effect. So, for instance, most surgeons are sociopaths. Mm-hmm. They don't feel empathy. Why? Because to cut into someone's skin and do all that, it's very... You have to be able to detach yourself from someone's emotions, from someone's feelings. And the people who are successful surgeons are the ones that do that. Similarly, if this is... assisted suiciders would have that ability as well, because they would be self-selected. You wouldn't have someone who really, really cares about patients and people, doing that. Same as, surgeons.
So I have two arguments for that. I'll start with one. We're talking about the doctor having the psychosis side effects of doing this over time, because that is one of the factors, correct?
Yeah.
Okay, enter in this. So right now, how the healthcare system is set up for a lot of jobs is doctors and even military have assigned therapists and psychologists that actually see them after traumatic experiences. And to help verify, okay, they're still in a good state of mind. Because as you guys were saying, you don't want a doctor who's had a concussion working on you in any way, shape, or form, because they themselves now have alleviated it themselves from the job, eliminated it because they can't. They can't do it. And that's not okay. You don't want that. So that is a thing that's happening right now. There are therapists and psychologists that do reviews with these doctors to make sure they're still in good health standing to do things. So just have them check each other out. You know what I mean? Like, continue to administrate that. Number two, I am a very emotional person. Like, I really act on emotion. I feel for people. I say I feel a lot more than I understand or I agree. It's like, yeah, I feel you. I got it. And I am saying that if I was a doctor, I would be more than happy to help assist in releasing a person. So that kind of shoots that last argument down a little bit, because I feel, and I would be, if after all, they went through all the steps, they had a psychologist look, we cleared that out, we saw what was happening with their future, we've confirmed that what they have is chronic and debilitating, I would be more than happy to load up in peace.
My issue isn't necessarily with people in a lose-lose situation. My issue is with people with
in the medium,
no reason, who just want to die.
And that's suicide, right? Like more of a suicide?
And saying, murder me.
Okay, so that's more of a suicide thing. That is a...
With something like like somebody where you're taking pity on them. You have sympathy and empathy, and you understand that reasoning versus just like this is a completely normal, healthy person. They could be a great member of society and they just want to die. Like there's more there that I think would have a debilitating effect on a doctor who has to administer that than somebody who you can understand, because it's a lose-lose situation.
But that's a psychological issue. That person is mentally not okay.
That was my argument, but Nathan pitched a situation where that's not the fact.
Well, so this gets very hypothetical here, because both of you are proposing that it is, to want to kill yourself is kind of mental illness in itself, right? Unless under the right circumstance. And having no reason to do so would be, just unfeasible. It wouldn't exist. Now, as a kind of a medium between these 2 points, I would say, let's make it empirical, right? So we could put people through some kind of psychological tests, meet some kind of criteria, and actually determine, is this person crazy, or are they making a rational decision? Now, of course, I wouldn't suppose that someone who is making a irrational decision, or someone who is in some kind of psychosis or some underlying problem, that shouldn't be done, right? But with the people where they are actually making a rational decision, I think we could determine that, and if we could, it's their life.
Okay, I guess I was misunderstanding, because I do agree with that. Like you said, it's case by case, and if they are making a rational argument, and you can rule out, okay, there's no debilitating depression driving this, because you can reason that out. Hormone levels, dopamine, all the chemicals show and help decide, okay, yeah, this person has an illness, so no, we can't administer at this time with illness.
All right, Steve, just to check on something real quick. So your issue was the person, not necessarily with the person choosing to kill themselves, right? That's not so much the issue, but rather the issue is the person who is administrating the suicide.
For the sake of a euthanasia argument, yes. The suicide argument is a completely different argument, in my opinion.
I think they're similar. It's just different circumstances. So one, the circumstances
one involves another person and one doesn't. That's where I'm drawing the line.
They both involve people, right? So So in one case, there's a circumstantial reason for the person to want to kill themselves. They want to kill themselves. They get someone else to kill themselves. And the other instance, they don't really have a reason to kill themselves, or the reason is not so medical, but it's more, just what they want. They get someone to kill themselves, and they kill themselves. It's the same thing, it's just different reasons.
Right. And what I'm maybe I misunderstood your question, because what I'm saying is my issue isn't with somebody wanting to kill themselves. That's a different argument. The person wanting to kill themselves. The argument that I was having here today was regarding euthanasia, which involves a medical professional taking the life of a patient under their choice, et cetera, whatever the reasoning
doesn't matter.
Is not what the argument is, because that's what it ends up having to come down to, is the circumstances. But the suicide isn't where the issue is.
It's the administration for how it's administered.
Because the reasoning matters when you're involving somebody else.
Like the doctor doing it.
If you're not involving somebody else, nobody can stop you. You do what you do. Even if you're mentally deficient, nobody can stop you if you kill yourself. Obviously, there are ways to physically restrain somebody, blah, blah, blah. But like, if you're given the opportunity to kill yourself, you can kill yourself.
But to be clear here, so someone who is in a circumstance where, let's say they have debilitating cancer or some other disease that what's that house one?
Lupus.
Let's say they have lupus, right?
Lupus?
Right. And
sorry, I don't know why I always...
So let's say they have lupus, right? And they want euthanasia to occur. So involving a doctor in that case, would that be wrong or no?
Case-to-case basis.
Case-to-case basis. But the more it gets to less circumstantial cases, where it's just kind of the person, oh yeah, I want to kill myself. It's less and less ethical to bring in someone else.
The more it seems that it is a mental issue versus a physical issue with no cure, the more it becomes an ethical issue.
Of involving someone else.
Correct.
Okay. Now I'm very clear on that. Okay. Now, one thing I'll just leave, with my opinion, or a little connection I'll make between this topic and Odysseus with the whole siren thing, is I think sometimes a doctor has to be the person to strap the patient to the hull of the ship or the mast. And they have to say, you're going to be screaming, you want to go to the depths of the ocean to be with the sirens. But just hold on and this will pass. And then you'll be like, oh man, thank you for tying me to the hull or the mast.
That's a great metaphor. This conversation, I didn't make any dick jokes. I'm kind of upset about that. But I think we really dug into something that's really meaningful. It's so complex. It has ethical implications. It has legal implications. And it's given me so much to think about. Honestly, it's kind of changed my view overall. I went into it not being too opinionated and found that I had quite an opinion about things that I hadn't really thought of before. And that's really the beauty of this show, that sometimes we're talking about dicks and sometimes we're really delving into life and ethical dilemmas. And I really want our audience to connect with us, because this has given me so much to think about, and I don't think I'm done thinking about it. And I know that what we've talked about is going to continue to swirl in my head. And I'm hoping that other people will reach out to us on, if you know me personally or on social media or whatever, and just kind of give your opinions. And then maybe we can talk about this again sometime and bring up things that we didn't even think about or other people's opinions, and together, as not just the three of us, but as a community, we can all really kind of hash this thing out. And when it really comes down to it, together, we all need to talk.